My name is Drew Bednar and I'm an orthopedic spinal surgeon with McMaster University in Hamilton, Ontario, Canada. This little talk is what I like to call Dr. Bednar's dirty trick. It's a simple instruction on how you can start to rehab your body and strengthen your back a little bit in the early phases after spine surgery. Surgical patients very commonly think they need to charge off to physio right after the case is finished to get their strength back and whatnot, and that's certainly true for orthopedic injuries in the arms and the legs. Spines are a little bit different. Honestly, we have very little research data on how to optimally rehabilitate or strengthen a surgical spine patient. Most of what's out there goes to the simple small disc surgeries, and almost uniformly the research says a simple self-directed exercise program at home is just as good as spending time, energy, and money at the rehab clinic. In spine surgeries, until things have a chance to heal and gain strength, you really don't want to be bending and twisting a lot. That's true for the simple disc operations, where a lot of bending forward can encourage you to have a second hernia. And it's true for the reconstructive operations, when we need to anchor a lot of screws into your spine. The screws sit parallel to the ground. So if you're doing a lot of bending and twisting and leaping around at the therapy clinic, that's a good way to work your screws loose. We need to take some time, typically 3 or 4 months, for things to be strongly healed inside before you can be leaping around. Most exercises that people have developed or proposed to help you strengthen your back and your core necessarily involve a lot of bending and twisting, so that's obviously a problem for a spine surgeon. For most of my 27 years in practice now, I've recommended what I call my dirty trick, simple exercise modeled on what bodybuilders do, and it's worked very safely and effectively for thousands of spine surgical patients through the years. So, in simple principle, we all know what a squat exercise is in weightlifting or bodybuilding. Guys have that, or ladies have that heavy bar across their shoulders and they're going up and down. The pretty guys in bodybuilding who have that nice shape actually do that exercise with very light weights but lots of repetitions to bring their core and particularly their back muscles up into profile to show off their back muscles. I don't want my patients holding weights, but what I like to call a modified deep knee bend works very, very well. You don't want to be doing a squat. In a squat with your feet flat on the ground, you necessarily have to flex to keep your balance, and flexing back and forth as you do an exercise is going to make you throw your back out. In the modified deep knee bend, you want to be very straight going up and down. It's the act of holding your upper body weight perfectly erect on the pelvis without the barbell that's giving you the strengthening. How you do it is terribly important. For starters, I ask my patients to do just one set of exercises a day. And the reason for that goes to basic muscle physiology. If you take a muscle cell in the laboratory and zap it with a stimulator until it can't twitch anymore, it actually takes 2 days to get its strength back. That's part of the reason why people who exercise very seriously don't usually do it every day. They do it every other day. This isn't a heavy exercise, so once a day is probably good. But think about it, when people do heavy physical exercise all day, the guys coming out of the steel mill in Hamilton at the end of the work shift don't feel invigorated, they feel like dog meat. They're exhausted, and they don't build strength that way very effectively. Going to the gym on the weekend does it different. So, once a day, we want to do this little bit of exercise. To keep oneself straight going up and down, you've got to hang on to something to help with your balance. And it's got to be something beside you, a doorknob, piece of furniture. If you held it back of a chair, for example, it's going to make you go back and forth and you'll throw your back out again. So thinking about being straight, it's almost like a little flamingo maneuver where you're folding your leg up and down underneath you. You're going to have to end up on your toes. You cannot do it without getting up on your toes. Some people like me roll up onto the toes going down. Some people actually like to get up on their toes to start the exercise. Hanging on lightly just to help your balance, you come down to a full squat. This is a resting position for most people. It's a little wobbly, but it doesn't hurt. You don't want to bounce off the bottom after you come down because you're building up energy in your leg muscles as you come down. If you bounce off the bottom, you're just using your quads. You get down here, you stop for half a second, and then you take a breath. The breath goes out as you piston straight back up again. So puts a lot of strain on your knees. So you need to fool around a little bit with where your feet are to get comfortable. I actually take some glucosamine for my knees now because I do this exercise so much teaching my patients. First time you do it, you just slowly and carefully repeat the exercise. And some people will do 4 or 5 reps the first time, some people will do 10 or 12, but very soon something's going to start hurting. Usually it's your knee or your thigh muscles. Sometimes it's your back, sometimes it's your foot. You're thinking all the time about staying very, very straight. First time you do it, even if you've just done a few reps and you feel kind of silly and embarrassed, the first hint of something hurting, you quit. Don't push it. Then not that afternoon, not that evening. The next day, you do another set of the same number of repetitions. The next day you do it again, the next day you do it again. After a few days or a week, you'll say, gee, I can do that many comfortably. So then you do one more again. And then you do one more again a few days later and slowly work the numbers up. I can't say for sure what normal is in this exercise because it's not documented. But I think it's something around 30. Little old ladies in my practice, believe it or not, will regularly get to doing 30, 35 at a time. Students, when they're with me, listen to this talk, run off to the back examination room in the clinic. They can usually do 30. 30s when I've been letting people go back into a heavier work or competitive sports, and they've generally been quite safe there. So it's a good sort of preliminary goal. You don't want to do this exercise forever because it puts a lot of load on your knees. Once you hit a peak in the number of repetitions you can do, which might be 20 repetitions for some people, might be 40 or 50 or 60 for others. Patients tell me that doing them 2 or 3 times a week is enough to keep your strength up. And I certainly wouldn't recommend anybody to do it regularly for more than about a year, just because I hate doing knee surgery. That's simple. This obviously doesn't isolate your back muscles. You're actually going to strengthen your whole core. You're going to feel it up in here underneath your ribs once you've been doing it for a little bit of a while. It unfortunately doesn't get the anterior abdominal musculature for guys like me, but it gets just about everything else. Obviously, there's leg strengthening built into it. There's a little bit of balance training, which doesn't hurt a spine patient. You're going to get some cardio. Once you're doing 15, 20 reps, you're huffing and puffing. It's a nice sort of low-tech kind of global exercise. People used to do stuff like this in the military way back when. Perhaps they still do. I don't really know. You'll never hear it from anybody but me because there isn't a rehab facility anywhere that is able to earn a living with patients exercising on their own at home. But it works. It's convenient. You do it at home. You don't have to travel. You don't have to pay a fee to anybody. And it gets you started. It won't necessarily get you everywhere you want to be. When my patients' surgeries are healed and they've got their basic strength this way, a lot of them might still be sort of tired and fatiguing early. I'll let them into a more vigorous exercise program or to go to physio once they have a basic strength. If they're very stiff and sore, I might send them for stretching exercises or a stretching therapy program. But this is a good basic beginning for that first several months after your surgery when you don't want to be bending and twisting around. So again, you're just gently holding something to help with your balance and thinking about being straight. You come down to a full squat, stop for half a second, take a breath. The breath goes out as you piston straight back up again. Just slowly and carefully, kind of like that. It's not a sin to wobble a bit. I usually wobble a bit when I do it. Nobody's perfect. But this has worked very well for all kinds of surgical patients for 27 years in my practice, and it can work for you too.